Good morning, good afternoon, or good evening, wherever you may be listening today. It is indeed a pleasure to be here today to speak about training programs and qualifications of lab animal personnel. Today I'm going to try to give you a perspective from an AAALAC perspective, from a site visitor as far as the site team, as far as when they're going out. The importance of training has taken on an increased importance in the lab animal science community, and it particularly with the new edition, 2011 edition of the guide, it really surmises that training is imperative. Individuals must be trained and have qualifications and basic principles of lab animal care. It's interesting to note that in 1996, the previous version actually said that training should be an important component. So the importance is definitely in the 2011 guide. So today I'm going to cover four main topics. The first really to discuss the references used by AAALAC in the conduction of site visits, but also to talk about some basic concepts of training and qualifications that really forms the basis of how AAALAC site visitors will actually conduct their site visits and their assessments. And in the second part, after about 20 minutes or so, I'll actually go into what I consider the four-step process to assessing training and qualifications when out on a site visit for AAALAC. And then thirdly, I'll actually present some interesting hot off the press or newly surmised data from site visits conducted under the 2011 guide, focusing in on those that were identified as training related. And then finally, I'll conclude with providing some examples of narrative that was included in reports following site visits to show you some representative examples of the finding in the reports. So let's turn now to look at the basic references for AAALAC when conducting site visits, and also some basic principles in relation to training and qualifications of personnel. During the conduction of site visits, AAALAC site visitors will use one of three primary, or maybe all three primary standards, which includes the Guide for the Care and Use of Agricultural Animals, the Ag Guide, which I'll go to on the next slide, the ETS 123, which has applicability to our European countries, and then the primary reference that we're all very familiar with, or should be, is the Guide for the Care and Use of Laboratory Animals, better known as the Guide. And in the guide, there is actually that language I just mentioned, the fact that personnel involved with the care and use of lab animals must be adequately trained, educated, or qualified. And really this gets into the fact that we're dealing with biological models in the animals, and that any disturbance or moderation in their environment can actually change the science that comes from these animals, and therefore balancing that animal welfare with the science gives you the best amount of best quality data. The second primary reference standard is the Ag Guide, which was published, the most recent version, in 2010, and it also reiterates the fact that individuals must be qualified. In other words, must be qualified to do the training experience, that they must have been able to perform their job duties and do it on a daily basis. And then also ETS 123, which is the European Convention for the Protection of Vertebrate Animals, really surmises and supports the verbiage from the two other primary references where staff should be sufficiently trained in their duties. And so I think it's important to realize that all three primary standards are very supportive and in agreement in that regard. But let's now look at some verbiage, particularly from the 2011 guide, and look at some of the language in terms of defining and the training and qualifications of specific animal care personnel. Some general statements from the 2011 guide that talks about the qualifications of personnel required to conduct and supportive program depend on a number of different things, and clearly there are differences between institutions and animal programs. Animal programs can vary by the type of institution, whether in academia or the private sector or perhaps even the government type institutions, but also the size and complexity of an institution within academia. It could be one room, or it could be multiple rooms and multiple facilities where there's lots of investigator laboratories. Therefore, the size and complexity of the institution is very important when looking at training programs. And it's also important to realize that the administrative structure for providing that animal care and other type of activities, those training programs can be quite complex and have very different organizations in that regard. Types of the physical plant. Is it an outdoor agricultural facility? Is it a barrier facility? Is it a biocontainment facility? All of those may get into the complexity and the thoroughness of the required training. The number and species of animals. Clearly, if there are rodents, there needs personnel to be trained in that particular species, while non-human primates present different challenges, but also different concerns from an occupational health and safety standpoint to just normal physiological responses and behavioral responses. And then also, let us not forget the fact that training programs really depend on the biomethodologies, the types of research, teaching, training, or production activities that's occurring, and the type of training may vary in that regard. I think it's very important to highlight two key words in this next slide, institutions and the IACUC. It's important to note that the guide identifies the institutional official to represent the institution as a senior administrator or manager in the animal program, as the individual that has the ultimate responsibility for the animal program and responsible for resource planning and ensuring an aligning of the program goals with the institution's research or production or whatever the mission may be of the animal program. So that institutional official needs to provide resources, whether in terms of monetary support or personnel support or training materials or organization for training for the institution. Similarly, that charge is also carried over to the Institutional Animal Care and Use Committee, the IACUC, or other oversight body in some countries that provides the oversight of the training and education program and for evaluating the overall effectiveness of the training program. It's left very open-ended on what those evaluating the effectiveness may be, but we'll touch on a few of those points shortly. A very interesting statement is included in the 2011 guide that program personnel training should be documented. Many institutions have always included training records and documentation, but the guide, this was the first notable finding, and we'll talk about documentation again as well. There are certain hallmarks of effective training programs. We've touched on the administrative support and the resources needed, but I think it's very important to realize that each employee is responsible for their own training along with the institution. In other words, employees should and individuals should take the training very seriously, because the training helps them to perform their job duties and also to keep them safe within the occupational health and safety arena. Excuse me. Employees should be required to participate in the training even before they start their work with animals or in the animal areas, and the training program should include everyone. And what this does is it allows everyone to work in the optimal performance and carrying out their duties, but also it's also important to realize that an effective hallmark of the training program is effective coordination among program components, ranging from IACUC, the oversight body, to the researcher, to the veterinary staff, to the animal care staff, and even to the folks in the occupational health and safety area. This schematic is something, a schematic that I have modified and adapted from Benoit and a Bain paper in 2005, where we were looking at training the trainee. And at the center, representing the institution, is the IACUC, that actually where their training requirements permeate out to other aspects of the animal program and the various components. And what you'll notice there, I also have identified core elements, because in any animal program there are core elements that everyone associated with the animal program needs to be aware. Later we'll have a slide that highlights some of those core elements, but then there's also other additional training elements that really go into the type of research, whether it's biomethodology or perhaps folks with limited exposure to a certain species or whatever. So core elements of training which are built upon as a foundation for unique specific training elements as well. So let's look at some of the staff and individual job duties listed in the 2011 guide. First, starting with veterinary and other professional staff. And it really states that it's an imperative, it's a must. Whenever it talks about the veterinary staff, must have experience, training, and expertise necessary to evaluate the health and well-being of the species used. Again, experience and training may be working with non-human primates or expertise with rodent barrier or biocontainment areas. Whatever it is, for that program, the veterinary staff needs to have that experience and expertise. The other professional staff should have training and experience as well. They may need training in a plethora of different areas. The guide actually lists several suggested topics which are listed on this slide, and you'll notice there's a broad array of different topics that veterinary professional staff will likely need to be successful in their job functions and job duties within the animal care and use program. The animal care staff, the husbandry staff, should receive training and have the experience and before they even start working with animals. And when we talk about animal care staff, it almost sounds like it's a centralized function, but animal care staff may be under the guidance or supervision of an investigator, and therefore a decentralized program. Again, those core elements of training with oversight by the IACUC will be very important to ensure that the training of those care staff or individuals caring for those animals are sufficient. It's very important to think about, again, the plethora of type of topics ranging from husbandry to perhaps technology to administration, and then there's a number of certification programs out there as well as non-degree training that can occur to augment and support the training that would be necessary. It's also important to think about and to consider that there needs to be some type of ongoing training to continue individuals to have the education and training to continue their jobs. We're dealing in a very highly technical world with ventilator racks and elaborate and sophisticated engineering systems that individuals need to have a basic understanding to responsibly conduct their activities. As I mentioned on the previous slide, there's well-defined training programs in-house, and also the fact that there's other types of methods of certification to obtain that training. Also mentioned that documentation is also important to document who provided the training and in what context and when it was conducted. Let's not forget the research team as far as training, and it should be tailored to particular needs of an institution, but it's important that the core training that I mentioned earlier that permeates out under the IACUC oversight is provided. And here I list some of what I consider the core training amenities are mentioned in the guide as important, and you'll notice that they vary from understanding basic regulations or guidance from IACUC function to reporting of health concerns or reporting of other concerns, but also occupational health and safety is listed there, OHSP, which is very important. And then the IACUC, also our comparative oversight body, does need its training as well. It's really up to the fact that IACUC members may interact and meet with animal care, animal personnel, husbandry personnel, research teams, and they need to be provided with not only introductory type training when they first join the committee to understand the roles in protocol review and inspecting the different facilities, but also they need to understand the regulations and policies and SOPs for working in their home institution. It's also important to realize that the IACUC members also need ongoing training opportunities because the expectations do change. Technology changes. To be aware of different animal models and applying the 3 R's. So the IACUC members are another group that really require training. And IACUC members are commonly investigators within an institution, so therefore the training programs may have different components that complement each other in that regard. I touched on the importance of training as related to occupational health and safety earlier, and a vital part, as you'll see later when we start looking at some results from site visits over the last 2.5 years, occupational health and safety is dependent upon appropriate training of personnel that can, one, follow defined procedures for safely conducting their studies, and then 2, understanding the hazards in conducting their duties, ranging from work with biohazards to allergens to other types of exposures, and then also be proficient in applying those understandings of the hazards as well as the clearly defined procedures, working with either engineering type protection, how they work there, or wearing appropriate PPE. All this comes into play, but these 3 sub-bullet points are very important because they clearly define the training program in terms of occupational health and safety. Various training topics should be included when you're looking at an occupational health and safety program, and there's cautions, there's some special health considerations for women of childbearing years, folks who may have some type of ongoing illness or immunosuppression. So there's some special health considerations in terms of the common occupational health and safety components of zoonosis, as well as handling waste materials and hazards. So quite a list there of various topics. This is a slide that I've used before, not only in training, but when I look at occupational health and safety programs. But what this does, on the outside, you see all of the different elements related to training, from occupational health and safety to laboratory animal staff to the trainer, as well as the vet staff and the IACUC. And in the middle, you have the trainee. And what this slide implies is that it goes back to the fact that it's a team approach, that it requires effective coordination among all the program components in devising the training program for individuals. This slide is a development of the fact and represents the fact that many institutions, their animal program may be quite complex, where they have defined trainers within an animal care and use program that can actually help coordinate the many elements of the training, and they can provide not only didactic training, but actually hands-on or performance-based practical training. And the key part, and you'll notice, is the bidirectional arrow between the trainer and the trainee. And what that gets into, and what I'm trying to convey here, is the fact that the trainer is observing the trainee to monitoring the proficiency of individuals to perform the task. In many cases, these observations of proficiency monitoring may lead to some type of a formal documentation check sheet for important tasks, but more importantly, may identify gaps in the existing training program that can be adapted by the trainer for more efficient, more effective training in the future. This slide really depicts various approaches to training. They are vary considerably. I think the key components of this slide really reflect the fact that there needs to be training before any animals are worked with by an individual within an institution, and that there should be some form of ongoing training at some defined periodicity. Didactic training is a given in most animal care programs, but again, the demonstration of proficiency, the hands-on type training is becoming more prevalent and really helps emphasize the fact of how something is done, as well as emphasizing the knowledge-based training of why we perform activities the way we do, and also why the training is necessary and why a procedure needs to be done in a specific way. One could always ask the question of the roles of the trainer and what are the qualifications of the trainer. The development of some form of quality control or auditing process by the trainer is also important, in addition to their qualifications. The trainer many times is a very experienced technician, or perhaps a veterinary technician, or perhaps even veterinarian coordinating some of the training. But then looking at the ability to identify the core element training that we've discussed, as well as specific biomethodology. But in any regards, as we alluded to previously, if there's a method, a process to assess proficiency training and competency in required tasks, that helps augment and really solidify the training program. And that concept has recently been published by Clifford et al. In JLAS, where they talk about assessment of proficiency and competency training and looking more at laboratory animal biomethodologies, but in any type of husbandry training, that is very important. I know at my home institution, we have developed checklists and check sheets, as well as other forms to look at all aspects, ranging from animal care to dosing to administration, and we use that when we see gaps to augment our future training, and it really helps our training groups. And again, this slide is really supportive of the previous slide, that how to assess training, looking at trends or gaps, using check sheets for refresher training to strengthen your training program, and in other words, it becomes a self-check for individuals performing their jobs. So let's take a switch now, since we've covered some of the basis of the training, and actually look at how site visitors may actually assess training qualifications in a program. And so the bottom line is, how does AALAC assess training programs? And I think you'll hear this many times from your site visitors, as well as when you're trying to say one size does not fit all, that it's a performance approach. And this performance approach starts in what I call a multi-step, a four-step process that we'll go through now. And when you think about the performance approach, the 2011 guide really surmises what that means, that it requires a combination of professional input of program participants, sound judgments from individuals, and a teamed approach to achieve specific goals. Much like the graph that I used earlier that showed the program elements on the outside of the circle, all going into the trainee in the middle. It's very important to realize that training requires due diligence as far as making sure that there are performance standards in play in the institution. Thus, what are the desired outcomes and goals of that training program, and what type of measures are being used to assess it? Well, before an AALAC site visit, an institution will actually conduct a very detailed self-assessment, which generates a program description, which are a long list of questions about a program that follows along the 2011 guide. And in the 2011 guide, in the program descriptions, there are a number of questions soliciting information for how training occurs for the various groups. I won't belabor these groups because we discussed them previously, but they include the IA cook, veterinary other professional staff, and the animal care staff. It also discusses the expectations of the research team, and just as importantly, it's also important to realize that the program description will ask specific questions related to training and the experience of personnel who actually perform surgery. Perhaps understanding aseptic technique. How about performing anesthesia or carrying out euthanasia procedures? So these are very important aspects. And describe the training and opportunities for continuing education are also important as well. As we talked about, the occupational health and safety program requires a number of different topics to be conveyed to trainees or individuals in the program, ranging from zoonosis to personal hygiene and a number of other considerations. And we discussed those earlier related to folks that may be having immune suppression or have some illness that are ongoing. But it's also very important to discuss the various hazardous agents in animals, making sure that folks are aware of those hazardous agents, how to take precautions and use of those hazardous agents, and so many times a table is included in the program description that identifies those hazardous agents and the precautions in that regard. And part of the information that will be solicited from the program description or during the on-site assessment by the site visitors will be the initial core element training, which we discussed before, which can cover a plethora of different topics. Many of those are listed here, and we'll discuss the last one as far as standard operating procedures shortly. But then part of the information that we talked about proficiency training relates to the on-the-job training, and it's important for folks to realize that who's performing the job, that they are knowledgeable and they are able to demonstrate those skills and to be able to explain why they're doing those skills. That conveys confidence and provides assurances to folks who are assessing the training that folks really are qualified to conduct those type of activities. And then lastly, really that the training continues on in some type of frequency, and that it covers changing regulations as far as, and also technology, and also what frequency is it occurring? Is it a yearly basis? Is it every 2 years or whatnot? But it may be influenced by the group. IACUC training may not be as often as occupational health and safety, or because it's a special needs facility, biocontainment with non-human primates will require more frequency training from both groups. And then also, how is the training occurring? Is it all in-house? Are folks attending national or local type lab animal science focused type meetings or research meetings? Or perhaps there's a high level of certification in a program, or different policies and SOPs reviewed on a periodic basis, or perhaps much like the presentation today, it's a web-based educational session. Step 2 of the assessment, as I like to call it, is actually observing individuals performing the task. We've already discussed the fact that the program description provides that detailed self-assessment where it provides the basis and is read intensely before a site visit, but then the best place is to observe folks conducting their duties. Animal care staff, most animal care staff may be in a centralized department such as the Division of Lab Animal Resources, or perhaps it's decentralized where the training is conducted only by the research staff, the principal investigator. Are folks aware of occupational health and safety issues? Are they working with animals, rodents, and are they aware of allergies? Is there posted signage available for hazardous agent uses occurring? Those are all triggers into making assessments when actually conducting a site visit. How about the veterinarians and the veterinary technicians? What is their process when they're going through to treat patients? What do their records look like? Are they recording them promptly? Are they as far as core technicians, it may be breeding cores or surgery cores, are they all performing the procedures together or in the same manner? How about dosing? Are the animals stressed? Are they calm? Looking at subtle keys or subtle triggers helps site visitors assess individuals in performance or duties and understanding, gain some insights into the training programs. It's very similar for the research staff. Love to visit laboratories and watch individuals conducting procedures, looking at species. Are they handling species appropriately? Are they familiar with the biomethodologies ranging from surgery to dosing to euthanasia? Our research staff, are they aware of occupational health and issues? Have they been risk assessed? All of this gets into awareness in the training programs of an institution. So how about step 3? Step 3 is really a discussion of activities relative to the training, looking at for consistency of information, comparing information as described in the program description to that described in standard operating procedures, policies, and IACUC protocols. Is there consistency across the of the different documents as far as procedures, and are individuals familiar with what's included for their duties? For example, if someone is conducting a surgical procedure, is it included in the IACUC protocol? Is it included in their standard operating procedures? Are they conducting it as described? Therefore, have they been trained in those procedures? Love to have discussions with the oversight body or the IACUC to gain information about what type of training the IACUC members receive when they join the committee in the conduction of their duties, and then also to discuss what type of continuing education opportunities may exist for members during their tenure on the committee. Also, it's also important to gain insights into what type of expectations may occur for research staff, for the veterinary group, for individuals that may perform animal care activities. Also, it's very informative to meet with representatives from the occupational health group as well as the various safety groups. Understand their training expectations for program participants for animal care as well as the experimental aspects, and what are their procedures for decontamination and so on and so forth. And then again, meeting with investigators and researchers and lab staff in labs and procedural areas can be very insightful and provide insights into ensuring that individuals have been qualified and trained in the procedures that are being conducted. And then finally, the fourth step for site visitor many times is the document review. And it really starts with not only the program description, which we've talked about previously, but also it gets into the standard operating procedures and the various policies within the institution, whereby expectations for activities and processes are defined within the animal program, and these standard operating procedures and policies help ensure consistency within the animal program of those expectations. So awareness of those SOPs and policies provide guidance and a roadmap, almost a cookbook, to many of the processes that are occurring. Does these SOPs and policies coordinate well with established and approved IACUC protocols? And how about program review and inspections? During the tours through various vivariums and things that may be found, is the IACUC picking these up on IACUC inspections? Therefore, are they trained to identify areas that could be minor deficiencies, for example? It's always important to look at records. Records of husbandry activities, animal care, were animals looked at on a daily basis? Did they have provision of food and water? How about the veterinary medical records? Were animals reported, were they observed by a veterinary technician or veterinarian appropriately, consistent with the program description and established policies and procedures? How about the medical records? Did it, when an animal, a case was resolved, does the medical record reflect that? Were doses and drugs administered only specified veterinarian's orders? So a number of different records in those regards. but then it also documents that like to be looked at are perhaps the materials that are used to provide the training. Excuse me. This training could include manuals, and more common today is web-based training, such as this webinar today. So anyway, it's important to really look at all of the different types of documents to give you insights into the training program. And then the last part of the step 4 is actually the documentation at hand. Who provided the course, what was included, who was the trainer, what is the data training, and then how does the document forms match the curriculum of what was covered during the training. So it all comes back full circle. And I'll just include this final part of what the site visitor may be looking for, and to state that many times findings on the site visit are commonly related to inadequate training in some manner. Although many times it may not be classified or categorized as a training deficiency, training is a key component for any aspect, for any duties that are being performed in the animal program. As I mentioned at the beginning, part 3 is actually I'm going to share with you some data from site visits with the 2011 guide, starting with the fall of 2011 through the summer of 2013. It's important to realize that findings are categorized either as mandatory items or suggestions for improvement. Mandatory items are those that must be corrected and correspond many times to must statements in the guide for a program to either gain accreditation or to maintain accreditation, while suggestions for improvement are purely that. There are suggestions for best practices or something that the institution should perhaps reevaluate. And I also want to mention that the AAALAC calendar is broken up into 3 trimesters during the year: summer trimester, fall trimester, and the winter trimester. And so this data represents about 2 years worth of data with the 2011 guide. During this period of time, there were over 4,800 different findings, and from those 4,800 findings, only 95 were related to training. So training represents only about 2% of all the findings. Not to say that training was could not have been a component of the other findings, but those classified purely as training were only about 2% of those 4,800 findings, which I find very insightful or very interesting. I also want to mention before I go into looking at this data, it's important to recognize that the data that I'm going to present over the next 3 slides is preliminary and is being intensely reviewed and confirmed in the AAALAC office, and final and more confident data confidence in the data will be presented at the upcoming AAALAC conference on April 1st in Denver, Colorado, entitled The Path to Success Under AAALAC's New Standards. I would encourage you to attend, as information will be informative over the first 3 years of the guide. So I would encourage you to attend if at all possible. But what you can see from this slide is the data for about 2 years of using the 2011 guide, and when a finding was related to training. And what you can see is that when you subcategorize the data into 2 different groups, training findings that were in the reports from the site visits had most of those, about a little over 40 of those findings were related to training issues in the occupational health and safety program. This was followed by those in the IACUC or oversight body, and followed closely by those in personnel and job duties, and only a small number of those were related to classification as a documentation. To look at the data on a percent basis, and these are percentage of all findings, whether they were mandatory type findings or suggestions for improvement, but they're still categorized that over 40% of the findings were related, again, to occupational health and safety, followed by IACUC, and then closely followed by job duties and personnel, and then a distant fourth is actually related to documentation. Now, when you break these out into mandatories, which are on the left side of the slide, while on the right hand of the slide are the suggestions for improvement. Of the 95 findings, 19 of them are mandatory, while the vast majority of those are suggestions for improvement. Again, mandatories on the left and suggestions on the right. And what you can see is that somewhere between 55 and 60% of all mandatory findings were related to occupational health and safety, while AAALAC was a distant second, followed by personnel and job duties, and there were no mandatory type findings related to documentation. The same trend continues as far as suggestions, but the same number of AAALAC and categorized as job duties and AAALAC findings were for suggestions, and on all findings related to documentation were suggestions for improvement. And so with that, you can see that occupational health and safety findings categorized as training were more common than AAALAC job duties qualifications, or those related to documentation. So now, in my remaining time, I'd like to go over some examples of findings from the site visits. These were actually in the report, starting first with occupational health and safety. And in this case, the animal facility supervisor had not been informed about hazardous use in the facility and didn't know what precautions were necessary. And so this was a should statement that the institution should look at the various safeguards. And if you recall from the training, initial part of the training for occupational health and safety, personnel should know about the types of procedures for conducting their duties, should know about the hazards involved, and they should be proficient in implementing required safeguards. Another example relates to walk-in cage washer or autoclave safety. I just want to pause here and just inform you that if you're not aware, AAALAC has a number of position statements on its website, including one on cage washer and autoclave safety, and that forms the basis of this occupational health and safety finding that was found on a site visit using the 2011 guide. And then also the fact that there are over 50, somewhere between 50 and 60 frequently asked questions on the AAALAC website as well, and these are highly informative, so I encourage you to go to the AAALAC website if you haven't been before. But in this case, there are three key factors that must be considered when developing a safety plan for walk-in autoclaves and cage washers. First is ease of egress, the second is a de-energizing mechanism, and the third is actually, it relates to, there must have been training of personnel. Without those three items, it could be a mandatory item. In this finding, there was a de-energizing system and an ability for individuals to exit the walk-in cage washer, but there was no personal training conducted on safe operation of that walk-in cage washer. Therefore, the finding was left that operators must receive appropriate training. I also want to say that there are additional ways to address this instead of egress and de-energizing if you look at the position statement. So again, further information here, you should go to the position statement on the AAALAC website. An additional occupational health and safety finding is listed here, and here hazards were being used, and the hazards here are allergies and allergens. I think it's well documented in the literature that rodent urinary proteins are very strong allergens, and in this case, personnel had not been trained and were not aware of those allergies and allergens from urinary proteins from rodents, and therefore the suggestion was that individuals should be provided with clearly defined procedures, understand the hazards, and be proficient in implementing those safeguards. And then one final occupational health and safety finding relates to recat needles that were found in the sharps box. there are times when recapping of needles before discarding is appropriate, but if there's not a policy or expectation in that regard, and people are not aware, then that could potentially lead to a finding related to training. And in this case, that was indeed the case, where training of personnel should be in place to prevent injuries from needles that had been recapped. Have a couple IACUC related type training findings. And in this one, there was a well-established documented training program for IACUC members. However, there were no records and no evidence that several members of IACUC had received that training, including the non-affiliated or non-institutional IACUC member. And so, therefore, this was left as a suggestion to the institution that all folks should receive training, IACUC members, and the training should be assured by the institution. And this is actually a very similar IACUC type finding, where there was a general overall lack of IACUC member training. So a couple examples here. There was approval of a protocol amendment, but there was lack of a forum at during the meeting when that was certificate protocol amendment had been approved. There was lack of participation by the non-affiliated member. And even though the 2011 guide was an expectation, when this site visit was conducted, they were still using the 1996 guide as the primary standard. And so in this case, since there was a general lack of member training, this was more of a mandatory finding, and stating that the institution must ensure that IACUC members are provided with sufficient training, not only to understand their roles and responsibilities, but also the fact that there should be opportunities for ongoing or continuing education. A couple examples of personal qualifications. In this place, there was an inconsistent training program for members of the animal care as well as research personnel. And this actually talks about training should be documented, but it was also the fact that the training had not occurred, therefore it was left as a suggestion. And then this also relates to personal qualifications, where the training of research personnel was the responsibility of an investigator rather than being a centralized function. However, the IACUC was not providing adequate oversight to that IACUC and that training program for that investigator, and therefore individuals were working with animals without that appropriate training, and there were no records to document who had been trained and in what areas had occurred. And this was left as a suggestion that those training in the system used to document training should be re-evaluated. And then the final example relates to documentation. In this case, there was a required training program for individuals that were working with animals for their actual hands-on or proficiency type activity, but there was no assessment being done, and there was no mechanism that was also occurring. And what was interesting is that this was entirely a web-based program, and so the suggestion was left that the IACUC should reassess the training record requirements to ensure that there is appropriate documentation. And therefore, that correlates back to the training that had occurred to individuals. And then finally, a summary slide, hopefully some training goals for the day, and hopefully to summarize that effective training programs are important in an animal care program, but they involve a lot of different groups, and that includes administrative support in terms of funding, as far as personnel, as far as materials to train. And very, very important that there is adequate coordination among the various program groups, from the IACUC to occupational health and safety to the animal users themselves. And then site visitors from AAALAC will use performance-based approach. What is the evidence to support that the training programs are adequate and personnel qualified to perform their duties? And then finally, just some insights as far as with the 2011 guide some experience. Preliminary data suggests that both for mandatory and findings as well as suggestions for improvement. In the training area, those categorized as training, those in occupational health and safety had the highest number of findings, followed by those by the IACUC. So with that, I want to thank you for your attention today, and I see that we have about 9 to 10 minutes for questions, so I'm going to open up for questions. So the first question we have is, what is the best way you've seen to document and track investigator training, research staff? And really, there's no one a right way. It's what works for each institution. What may occur is, what are the core elements training that is going to occur for research, for principal investigators and training the research staff? What are your expectations? Is that being provided from someone from the IACUC or perhaps the lab animal staff? But then as far as training specific elements, sometimes that can be handled through an IACUC protocol, or it could be handled in a general training template. So it really, again, it depends on the organization. I think the key is that for whatever procedure is occurring with animals, that there is a training form that corresponds to when that training was recorded, who provided that training, and what was the context of that. Okay, the next question. It relates to types of surgery, and the question relates comes across as, for surgeries such as cranial surgery, there's many different types of procedures that are being performed, and what type of separate sign-offs for each of those specific procedures? Well, I think that's a very good question. If a training documentation defines what cranial surgery, what procedures may be listed, I think cranial surgery may be intracerebral ventricular injections, but it may be a microdialysis. You define that cranial surgery that be individually listed on each specific type of procedures. There are different techniques for each of those, and I think the site visitors would want to ascertain what is the evidence that the training corresponds to the procedures being formed. How the IACUC evaluated to ensure that the appropriate training has been informed as well. Next question relates, this is a very good question from one of our veterinary colleagues. Talks about the turnover rate of research assistant students that work with the PI. Whose responsibility is it to provide the training and documentation in those cases? And I think that's a great question. If you recall from early in the presentation and from the guide, the oversight of the training programs really rests with the Institutional Animal Care and Use Committee, the IACUC, or the oversight body. Along with that, the attending veterinarian or veterinarian is part of that IACUC. So it's a group effort as far as ensuring that appropriate training is occurring within investigators' laboratories. And I echo the fact that I understand the fact that particularly in the academic setting, you tend to have a high turnover rate among technicians as well as students, and those students may be graduate students or they may be undergraduate students, and it's very difficult. But it's imperative that those populations are captured as far as the training program, particularly in the core training elements as well as the occupational health and safety. So the general answer would be the IACUC would have that responsibility, but that should include other facets as well. Next question relates, how would council feel about the use, for example, of the AAALAC Learning Library for researcher training? I think Well, as a council member, I've seen the AALAC Learning Library being used for investigator or researcher training in a number of different places and being used successfully. What would be good to do is also think about the proficiency type training, hands-on training that may have occurred with those individuals as well. Again, doing assessment proficiency training allows one to assess whether the trainee understands the training and can perform those activities. We actually use at our institution check sheets where our trainer goes out and actually looks at training that is being conducted or activities being conducted and correlates that back to the training programs. So didactic training such as the AALAC Learning Library or city type training or whatever, many times does not give you that hands-on training, which is where the adage comes in, where the rubber hits the road, and it's very important as well. The next question relates to the GLP environment, and it says, is it acceptable for the quality assurance unit to audit veterinary procedures purely based upon internal SOPs, given that the QA unit, quality assurance unit, has no veterinary background training themselves? Well, being a toxicologist myself and working previously in the private sector, I can ascertain that many quality assurance auditors can do a very good job. However, the goal of the quality assurance inspection is quite different and can be quite different in a private sector or an academic setting that may be conducting GLPs. So I am reluctant to say that it could not be supported, but I think again, a site visitor or anyone should look at the performance outcome. Is the QA auditor someone who is versed and has appropriate veterinary or laboratory animal science background? So it has to be qualified, but again, if you think of using performance-based assessments, that's the best indices of whether the training program is sufficient and adequate and meets the needs of the program. Next question is the attending veterinarian the best one to do the training? I serve as an attending veterinarian, but there are other veterinarians, clinical veterinarians here that their clinical skills or their technical skills may be better at some things than mine. So it depends on the size of the institution. It depends on the research needs of the institution. I think the attending veterinarian needs to be involved in have their hand in the training as far as course content or the type of things that should occur, but I do not think the attending veterinarian is always the best one to do training. It really depends on the program, and then again, what are your performance assessments of the training program? Is it meeting the needs of the program? So I think it just really depends. So that's the last of the questions that I see. So with that, I would like to again thank everyone for their attendance today. I hope the information was informative in regards to the training. And so with that, I'd like to thank you for your attention and hopefully have a good day, good afternoon, and good evening. Thank you so much. Bye-bye now.